Thank you, Mayor. I'd like to thank all the healthcare community leaders behind me, all of you for being here, especially the firefighters, paramedics. Work hard 365 days a year to make sure that we're always safe. So with that, I'm excited about the Community Protection Initiative. It was something that was brought to my attention by Fire Chief Eric Litzenberg and Andres Mercado a few months ago, and I think it's a great plan. As the former fire chief, as the mayor stated, this has been a problem in our community for over 30 years that I can remember. And what they came to me was an innovative approach to really changing healthcare in the city of Santa Fe. They have always been the leaders in New Mexico as far as innovation, technology, the way we take care of business here in the city fire department, and this is no different. They are leading the way, and I'm sure this initiative will change the way we see healthcare in New Mexico from an emergency medical services point of view. So with that, I look forward to moving this forward and working with other city councilors, other city leaders to make sure that this program, this initiative is successful. So with that, I'll introduce Fire Chief Eric Litzenberg.
Good morning, everybody, and thank you for being here. Like the mayor and the councilor, I'd like to thank the people who stand behind me from the medical community. This collaboration from the beginning has been impressive, and it continues to grow and continues to be more impressive. And like the two, I'd like to thank the Santa Fe Fire Department firefighters, paramedics, and EMTs for what they do every day. Without them, we'd be a far less safe community. So a little bit about the Santa Fe Fire Department. We are an evolving department, and we have been for many years. 30 years ago, we took on emergency medical services, which we continue to run for the city of Santa Fe. The mayor spoke of over 10,000 calls a year that we do for emergency medical services. We are a fire department by name, but a large portion of what we do is emergency medical. Over the years, we've also taken on other responsibilities. The wildland urban interface, the wildland firefighting that we do, the hazardous materials, and in recent years, response to homeland security threats and natural disasters. This is part of our evolution. The Community Protection Initiative is how we hope to change the landscape of healthcare in Santa Fe over the next few years. There's no question in my mind, with the collaboration that we have with the partners that stand behind me, the Santa Fe Fire Department can evolve and innovate into the future. In the next few minutes, paramedic Andres Mercado will talk about the nuts and bolts of what we're calling CPI, which is Community Protection Initiative. There's no question in my mind that everyone will be impressed with the impact that this will have in our community. Thank you for your time, and I would like to introduce paramedic Andres Mercado.
Thanks, Chief. And first of all, let me thank everyone that's here. This is truly about integrating the services that we have as a community, and this is not about the fire department doing something on their own. This is really about getting all the folks that are here from the hospital, from the state, from the different clinics, to work together with us to potentiate the services that we all provide. The United States healthcare system is a paradox. We spend more money than any other country in the world on healthcare, and our results are not something that we can brag about. The healthcare experts and economists across the nation have spoken in unison, and there is a lot of room for improvement in our system. The system has been compared to an orchestra of musicians. We have very well-trained, very well-intentioned providers, from technicians up to doctors, who come to work every day and give it their all, and we continue to have poor results. And it's not because of a lack of trying on the individual's part. It's because we are not coordinated well enough yet. And that's something that we're all striving towards, and we hope that this is a significant step in that continuum. Let me talk about, so there are many areas for improvement in our nation's healthcare system. And let me talk about 3 specific ones here in Santa Fe. So one of them is, I don't know how many times any of you folks have had to call 911 in the last 12 months, but if you've had to call 911 4 times, 5 times, 8 times, 12 times, 20 times, 40 times, maybe even 60 times, maybe there's a problem. And maybe the system isn't really addressing your problem in the most efficient way. There are many steps that we can take to help individuals who have essentially flagged themselves as not being able to navigate the healthcare system well, and some programs across the country are starting to address those issues and showing very positive results. Another area for improvement is our system is designed to respond to emergencies, to heart attacks, strokes, and major traumas. That's why we have these types of vehicles. That's why we have our infrastructure, our communication system, our training. But a growing number of the calls that we get through the 911 system are not best addressed with an emergency response infrastructure. They are calls for primary care issues that where the patient doesn't have proper access to the right level of care. There are calls for individuals who have low medical literacy and don't know how to take care of themselves. Problems with psychiatric issues, problems with behavioral health, with substance abuse issues. And oftentimes we respond as paramedics or emergency room staff to these problems that are not they don't fit our model very well, and we do our very best every day, but there's a lot of room for improvement to assure that the services that we provide match the need that the patients have. Another major area where we could improve is in helping the healthcare system is extremely complex. Even just individual health, how an individual stays healthy, that's extremely complex. And if the lack of understanding of health by many of our community members isn't always it doesn't always speak to their ability to their mental capacity. It often speaks to a very complicated system, and we hope that with some of the services that we will provide through the Community Protection Initiative, we can increase medical literacy in some of our most vulnerable populations. The truth is that this is a small selection of areas where we can improve. There is nothing but room for improvement in our system, and I am very confident that because of our ability to bring the folks that are here today together, there's the potential for improving the safety of our community is tremendous. The Institute for Healthcare Improvement, it's an independent not-for-profit group out of Cambridge, Massachusetts, who it's essentially a think tank around healthcare, has come up with the triple aim. And the triple aim is what I think we can all agree is sort of a compass on whatever actions we take in the future. And the triple aim is that we want to, as a country, improve the health of populations, so improve the health outcomes. We want to improve patient satisfaction of the care that they're receiving, and we want to do all that while we're reducing system costs. There's a ton of room for improvement, and I'm very, very excited to see all the folks that are here today. I think as a system, I think as a community, we're very fertile for this next step, and I'm happy I'm happy that we're all able to get together here today and show support for what I think could be the future of healthcare in Santa Fe. Thanks.